We are in our respective homes continuing learning due to the pandemic caused by COVID-19. But do you know what happens to our lungs when we contracted the virus? SARS-CoV-2, the virus that causes COVID-19, is part of the coronavirus family. When the virus gets in your body, it comes into contact with the mucous membranes that line your nose, your mouth, and even your eyes. The virus enters a healthy cell and uses the cell to make new virus parts. It multiplies and the new viruses infect nearby cells. The new coronavirus can infect the upper or lower part of your respiratory tract. It travels down your airways. The lining can become irritated and inflamed. In some cases, the infection can reach all the way down into your alveoli. As the infection travels down your respiratory tract, your immune system fights back. Your lungs and airways swell and become inflamed. This can start in one part of your lung and even spread. About 80% of people who have COVID-19 get mild to moderate symptoms. You may have cough or some sore throat too. Some people have pneumonia. It is a lung infection in which alveoli are inflamed. In severe conditions, both lungs were infected. The swelling gets worse, or your lungs will be filled with fluids and debris. The air sacs filled with mucus, fluid, and other cells that are trying to fight the infection, making it harder for your body to take in oxygen. How do you stay fit and healthy during this time of pandemic and community quarantine? Let's find out. Number 1, get fit! Activities like strength training and cardiovascular or aerobic exercise can help people get the most out of their lungs and can help increase how efficiently they use the oxygen. Walking, running, or jumping rope are just 3 examples of moderate aerobic activity, or anything that moves your body and burns calories has some positive effects on your body. Number 2, do not ever try smoking. You know what? According to the research of the American Lung Association, a significant portion of people who were admitted to the ICU for respiratory distress were current smokers or had a history of smoking. Both cigarette smoking and vaping are linked to lung inflammation and lowered immune infection in the lungs. Number 3, eat right. Foods rich in vitamin D and omega-3 fatty acids found in cold water fish like salmon and eating fruits and vegetables both help boost an immune response before the virus hits. Building up your immune system and reducing inflammation are both crucial if you are about to get challenged by significant viral infection. Now, what are the ways to prevent the spread of COVID-19? Number 1, wash your hands. Be sure to scrub for 20 seconds, then rinse. Number 2, cover your mouth and nose with a disposable tissue when you're coughing or sneezing, especially in public places. Throw it in the trash and wash your hands. Number 3, physical distancing. Stay away from large public gatherings. When you need to be around others, ensure a safe distance of at least 6 feet. Number 4, just simply wear a mask. Number 5, seek medical help when you feel sick with fever, cough, or have difficulty in breathing. Definitely contact your doctor and seek emergency care. And that wraps up our episode. This is Teacher Romeo. Always remember, learning science is amazing. Goodbye!